Cyanosis. Cyanosis is bluish discoloration of skin and mucous membrane. It is mainly due to the presence of deoxygenated hemoglobin in the superficial blood vessels. So, cyanosis means it is the bluish discoloration of skin and mucous membrane mainly due to the lack of oxygen blood supply into the tissues. There are mainly two types of cyanosis: central cyanosis and the peripheral cyanosis. Central cyanosis. Central cyanosis means it's a pathological condition due to the reduced arterial oxygen saturation. Here, the arterial oxygen supply or oxygen saturation is decreased. So, central cyanosis caused by mainly the condition that decrease the arterial oxygen saturation. It involves highly vascularized tissues. Central cyanosis occurs in the highly vascularized tissues such as lips, mucous membranes, through which blood flow is brisk and the arteriovenous difference is minimal. So, when we are observing the lips, tongue, mucous membranes, in these areas central cyanosis occurs. And cardiac output typically normal. The patient have warm extremities. So in central cyanosis usually cardiac output will be normal, but when we are touching the patient the extremities will be warmth. So that's regarding central cyanosis. This is the typical example of central cyanosis. The lips and the tongue is cyanosed. Next one, peripheral cyanosis. In peripheral cyanosis, blue-green fingertips, toes and palms that are called to touch, and color returns after the body part is warmed. So, peripheral cyanosis means it is the bluish discoloration of fingers, palms and toes. That means the extremities become bluish appearance. That is the peripheral cyanosis. And when we are touching these extremities, it will be cold. But in case of central cyanosis, when we are touching the extremities, it is warmth. And this peripheral cyanosis can be returned while applying warmth to that extremities or warmth to that area. The peripheral cyanosis will be returned. This is the typical example of peripheral cyanosis. In this picture, the palms, fingers and the toes are cyanosed. When we are assessing the causes of cyanosis, peripheral cyanosis and central cyanosis, we can learn the causes by studying the mnemonic called palms. Peripheral cyanosis, the causes are exposure to cold, any obstruction to the blood flow, then history of left ventricular failure and shock, decreased cardiac output. All this condition, cold is the mnemonic, all this condition, there may be chance for the peripheral cyanosis. Usually peripheral cyanosis is not that much emergency until there is no LVF and shock and decreased cardiac output. Okay, so that's regarding peripheral cyanosis. In case of central cyanosis may be caused by polycythemia, high altitude, lung diseases, methylsulfhemoglobinemia, shunt. In all these cases, central cyanosis occurs. And you can remember the causes of peripheral cyanosis by mnemonic palms. So, peripheral cyanosis and central cyanosis you can remember with called palms. The difference between central and peripheral cyanosis. The main mechanism of central and peripheral cyanosis is Central cyanosis mainly due to diminished arterial oxygen saturation. Peripheral cyanosis is caused by diminished flow of blood to the local area of body. Then central cyanosis, the main sites are skin and mucous membranes, tongues, lips, cheeks. Peripheral cyanosis occurs in the skin only, especially the extremities, fingers, palms and the toes. Clubbing and polycythemia. Central cyanosis is usually associated with clubbing and polycythemia. But peripheral cyanosis, it is not associated with clubbing and polycythemia. Central cyanosis is when we are touching the area, it will be warm. Temperature of the limb will be warm. But in case of peripheral cyanosis, temperature of the extremities will be cold. Local heat, the application of local heat remains the cyanosis in central cyanosis. The local heat application, it has no role in central cyanosis. But in case of peripheral cyanosis, cyanosis will be abolished and the normal pink color will be occurs. Then breathing pure oxygen or oxygen supply to the central cyanosis can be decreased. In case of peripheral cyanosis will be persist. So that is the main difference between the central and peripheral cyanosis. One more cyanosis is there, that is known as the acrocyanosis. Acrocyanosis occurs in newborn. It is the bluish discoloration in the hands and feet and around the mouth, circumoral cyanosis. The mucous membranes generally remain pink. It reflects benign vasomotor changes in the diffuse venous structures in the affected areas. It does not indicate pathology unless cardiac output is extremely low, resulting in cutaneous vasoconstriction. Cyanosis soon after birth, transition from intrauterine to extrauterine life. So acrocyanosis may commonly occurs in newborn when there is transfer from intrauterine to extrauterine life. The body will take time to adjust with the new situation. So that is the acrocyanosis. And it may occurs in hand or leg prolapse. So acrocyanosis is not that much serious. It will be resolved itself. It occurs when there is transition from the intrauterine life to extrauterine life. Here there will be bluish discoloration of the hand, feet and around the mouth, and mucous membranes remain pink in this acrocyanosis, mainly due to the vasomotor changes. So, the cyanosis means bluish discoloration of the skin and mucous membrane. Mainly two types of cyanosis, central cyanosis and peripheral cyanosis. Peripheral cyanosis occurs in the extremities, that is finger, toes and the palms. Central cyanosis occurs in the mucous membranes and the lips, tongue, and usually the central cyanosis due to the arterial insufficiency. Peripheral cyanosis mainly due to the lack of blood supply to the local area. The application of warmth that will reduce the local peripheral cyanosis, but there is no role in central cyanosis, and the oxygen application is better in central cyanosis. And one more condition is acrocyanosis that occurs in the newborn after birth. During the intrauterine life to the extrauterine life, there is some time is needed to adjust. So as a process, the acrocyanosis occurs. Here mainly the vasomotor changes occurs, and mainly the bluish discoloration in the hands, feet and around the mouth occurs. Thank you.